Hi everyone, welcome back to my channel. If you don't know me, my name's Lucy and I'm a final year medical student studying at the University of Nottingham, and in today's video I'm going to be giving you all my advice for how to perform well in OSCEs. For those of you who don't know, OSCEs are clinical exams you do in medicine where you have to rotate around a series of stations and basically just show that you're capable of being a doctor. So you have to take histories from patients, examine patients, come up with diagnoses, say what investigations you would do, explain diagnoses to patients, break bad news, prescribe drugs, everything that a doctor would be expected to be able to do at the level of a foundation year one doctor, which is what hopefully I will become in August. In Nottingham Medical School you do an OSCE every year, but they change quite significantly when you get to your third year. So in years 1 and 2, it's more kind of just reproducing examinations, and you don't really have to use sort of clinical reasoning skills, you don't have to come up with a diagnosis, you don't have to actually manage the patient. Whereas when you get to year 3 and above, you have to actually kind of come up with a diagnosis and say what investigations you do and what treatment you do. And in final year you also have sort of an A to B assessment of an acutely unwell patient as well, so they kind of get harder and harder every year. I didn't have my third year OSCE because of COVID, so it got cancelled, and so my fourth year OSCE was my first kind of proper OSCE that I had to do, and I was absolutely terrified going into it because it's a very new experience, and although we'd kind of experienced an OSCE before, we hadn't experienced a kind of proper one. So I just wanted to make this video to give all of my advice because I think OSCEs they're known for being a terrifying experience. You've got a 10-minute station, so you've got a time limit, you've got an examiner watching you, you're having to think on the spot, show that you can do all the skills, things like taking blood, putting cannulas in. In OSCEs it's very much you've got one chance at each station and you don't have much time to kind of think about what you're doing. So yeah, I just wanted to give all the advice I can that I learned when doing my fourth year OSCE, which actually ended up going really well for me, and I was really happy with my result in it. So I just wanted to try and pass on anything I can to help anyone else who is stressed about OSCEs. I'm going to split the video into 3 parts. So the first part being preparation for the OSCE, the second part being the day itself and how to perform well in the exam, and the third part being what to do after the exam. So first of all, the most obvious thing to say is that to do well in an OSCE you have to practice doing OSCE stations. Ideally practice with medical students because you'll be able to critique each other and help each other out more than if you practice with non-medics, but actually you can practice with family members and non-medic friends, partners. Really would just practice as much as you can. If you can find some ready-made stations either from your uni or from previous students or online, then definitely do that. And when you're practicing stations, don't just aim to get the right diagnosis and management plan, because obviously that's something you want to get right, but also you want to make sure that the questions you're asking and the steps of your examination are showing an examiner that you are ruling out other conditions and you're thinking about other things. I think OSCEs can often be kind of quite textbook, so someone will come in with a condition and you can know in a few sort of seconds what you think it's going to be, and then the more questions you ask about it, the more you think, yeah, this is definitely, like, it's a textbook case of this condition. But you want to make sure that you're ruling out other conditions as well, even if you think it's obvious, because I think that actually gets you extra marks. I'm not an examiner, I don't know what the mark scheme looks like, but from the practice stations I've done, asking about important other differentials, and when you're presenting your history to an examiner, then saying the important negatives is really important as well. So one of the stations I performed really well in the fourth year OSCE was an ophthalmology station, so it was about a patient with a bad eye basically, and I, after a few questions, knew the diagnosis, but from all the practicing that I did, I asked all these other questions just to rule out anything else. So something that came up time and time again was ruling out temporal arteritis, so asking about scalp tenderness, asking about pain when chewing, and asking about headache over the eye, and those sort of questions that are quite specific to temporal arteritis, which would actually be a very serious presentation, I thought were really important to ask, and I presented them back in my history. And that's something I always did when I practiced ophthalmology stations, and therefore did in the exam as well. And yeah, it just shows the examiner that you're thinking about those serious conditions. Another thing to do when you're practicing stations is to make a list of all of the things that you might forget, things that often slip your mind, so that you can read that or just go through that every time you do a station, even if it's just a list in your head, and you can check you've not missed anything. So for example, an obvious thing is asking ICE, so asking the patient about their ideas, concerns, expectations. If you're taking history in a station, then you know that you're going to want to do that at some point. So make sure that's just never a thing you miss, and then it will become so ingrained in your history that you won't have to think about it anymore. Similarly, with every sort of different speciality you're doing, so whether it's ophthalmology, paediatrics, obs and gynae, whatever it is, think about all the cardinal symptoms that you're going to ask no matter what presentation sort of comes up. For example, in ophthalmology, if someone comes in with a bad eye, you're always going to ask about visual symptoms, headache, any trauma, do they wear glasses, any systemic symptoms. You're always going to have this list in your head of all the things you want to ask before you're happy to move on. If you always have this mental list in your head of all the things that you've practiced and you've forgotten before, then it will help you make sure you cover them all in the exam itself. Also, don't just practice doing histories and examinations. They're probably the most simple things to practice because that's what a lot of the stations will be. But make sure you also practice explaining conditions and medications to patients and answering patients' questions about them, because that will also probably come up in stations as well. So I found that useful to practice with other medical students, but also just to practice by myself. So for example, if I'd be going through my flashcards and let's say one of them was about eczema, the management of eczema, I'd make sure that I could explain to a patient in a way they'd understand what eczema is, how we treat it, why those medications work, how to use them. So that could just roll off my tongue when I'm in the exam and I'm not having to actually think, oh, how can I explain eczema to a patient? I just know because I've practiced so many times. And actually seeing other doctors explain things to patients is a really good way to learn how to explain things. Often in clinics I've picked up a lot of sort of nice ways of explaining that doctors have done that patients have been able to really understand. So in terms of just acquiring that side of things, attending just clinical activities is really useful. Spending time on the wards is also really important. I think it's underestimated a lot. I think people think that when you speak to real patients, the histories aren't really like they are in the OSCEs, and that is true because in the OSCEs, obviously patients are told exactly, what to say and what symptoms they have and don't have, whereas patients in real life sometimes are more, they might elaborate on things a lot more, or they might kind of not know what you're asking as much or something. So they are different experiences, definitely. But practicing history taking over and over and over again on real patients definitely helped me in the OSCE, 100%. The more you've practiced, let's say a paediatrics history, the easier it's going to just flow in your exam, because again, you're not having to think about what's the next bit of the history. I need to remember to ask about vaccinations, or I need to remember to ask about development and milestones. You just know that because it comes so naturally, because you practiced it in real life so many times. And you can obviously practice with other students, but practicing on real patients is just really helpful for your learning. I think another thing that's daunting about OSCEs is having to showcase clinical skills as well. So that's things, like I said, like taking bloods and cannulas and doing injections, IV fluids, all those things, because they're probably the things you've practiced a little bit less than the history taking and examination, because that's a lot easier to just do on the ward independently when you're on placement. So make sure you look at all of your sign-offs that your med school has given you, because we're told basically that any of those sign-offs can come up in an OSCE station. So if there's any one of your sign-offs that you're not confident on, or you don't think you could perform in a slick manner in an OSCE, then make sure you practice it. Don't neglect any of them. Don't think that it won't come up, because it could come up. It would be silly marks to lose to not be able to do a cannula really smoothly and efficiently, because that's something that you can practice and be really slick at before you go into the exam. Obviously on the day things can happen, you can forget things, mess up, but if you've practiced it, then you've done all you can, and that you can fall back on your muscle memory. Again, for examinations, you just want the muscle memory. You don't want to be thinking about each step of the examination. You want to just be doing it because you've practiced it so much. So I think it's pretty obvious from this part of the video that practice, 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 that is the most important thing. So now let's talk about the exam day itself. So the first thing I'd say is prepare for all the things that can go wrong logistically. This sounds simple, but when you're stressed and anxious about an exam, you know, you just don't want any other stress at all that day. So make sure you get enough sleep, but at the same time, don't panic if you can't sleep and you feel anxious. Just, you know, take comfort in knowing that you're resting at night. Give yourself enough time in the morning to get up and get ready and not be rushing and get where you need to be. Sort out how you're going to get there, know exactly where you're going, and give yourself a pep talk. And this leads me straight on to my next bit of advice, which is to turn any nerves you have into excitement. I am normally an incredibly nervous person when it comes to things like the OSCE. So I used to get this with like my singing exams, piano exams, not so much with written papers because I feel like I have a lot of control when I'm doing a written exam and I have a lot of time to think and to, you know, mull things over and go back and forth between questions and things. But it's things like the OSCE where I'm on the spot that I find really, really nerve-wracking, and I've always found them really nerve-wracking throughout med school. But I had this really weird moment on the bus when I was on the way to where the exam was, where I just kind of had this overwhelming sense of confidence, and I just genuinely felt excited to do the exam because I was like, you know what, I have learnt so much in this year of med school. I've done my work, I've revised. The knowledge, you know, is something I'm really confident with. I'm never going to know everything, but I'm really happy with how much I do know. I thought, you know what, I've taken so many histories from patients, I've examined so many patients, I practiced so many stations, that I just kind of felt like I just want to show the examiners what I can do at this point. And if something comes up that I genuinely have no idea how to deal with, then that's just fair enough because I've done all I can. And as soon as I was feeling like that, I just felt so relaxed, and it was really strange because I've never been this relaxed before an exam like this before. And while I was waiting to go into the exam, I mean, I was nervous. Obviously I had some underlying nerves, but it wasn't that kind of real anxiety that I've had before with exams like this. I just kind of thought, bring it on, like, just what are they, I know it sounds almost cocky, but it was like, what are they going to throw at me that I'm not going to be able to deal with at all? Like, surely I'm going to know what to do a little bit at least. And so just take comfort in thinking of all the things you've done and all the things you've achieved that year at med school, and how much practice you've done at all the skills and the histories and the knowledge, and just be excited to go in there and show the examiners what you can do. And that leads me nicely on to my next point, which is you need to perform in an OSCE. You need to literally treat it like you're putting on a show. You really want to show off to the examiners how slick you can be, how concise you can be with when you're presenting histories or examinations to an examiner, how thorough you can be with a management plan, how caring, empathetic you can be towards a patient. So never think that something is like too obvious for you to say or do. So if a patient is saying they're in pain and you think it's obvious that you would give them pain relief, don't just think it's obvious, actually voice it and say you'd give pain relief, because it's literally going to take you a second to say that, and it just shows the examiner that you're not just focused on the condition itself, you're thinking about the whole patient and you're thinking what they need. My next bit of advice is not to forget all the things you learn in your communication skills sessions, so all the micro skills like active listening, chunking and checking when you're explaining things, being empathetic, all those things that you think are just ingrained in you after being at medical school for a few years. Make sure you don't let that slip because of nervousness or because you're worried about what a diagnosis is. Even if you're taking history from a patient and you're thinking, I've got no idea what the diagnosis is, I don't know how I'm going to manage it, just still maintain that professionalism, show off your communication skills, because actually that might be a large part of the mark scheme. And so if you're panicking and you're getting stressed and that's showing to the patient, then you might slip a bit in those marks. And then if you then don't get the diagnosis and management plan marks, that's going to be a bigger hit than if you just maintain the professionalism and then at least you're going to secure that side of the consultation. So my next bit of advice is to have a fail-safe way of ending any consultation or any station that you do. It might not be applicable to every single station, depending on how kind of unusual the station is, or if it's like an A to E scenario or something. But for kind of a generic history examination management plan station, then have a way of ending it so that you don't get to the end of the station and you've done really well and then suddenly you're kind of a bit awkward and you just kind of go bye at the end. You want a good way to end the station to kind of put the cherry on top. I think for me, for example, at the end, I would just had it in my head that I would always safety net. I'd always ask the patient if they had any questions, and I'd always say that I'd give some written information like a leaflet. Again, it might not be appropriate in every single station, but for the majority of stations it was a nice thing that I could end on, making sure I didn't miss anything. You might want to have something like checking patient understanding, or saying that you'd ask a senior for advice or something like that, so that you're always ending the station on a high rather than flopping at the end. I know when you get to the end of a station, it's almost like you're so relieved to have done it that you just want it to be over and you just want to move on to the next one, but you really want to keep pushing to the end to just really maintain that good sense of like professionalism, and show that you really know what you're doing. Another thing, just to reiterate again, is always remember ICE and always remember to pick up on patient cues. So if a patient mentions something in an OSCE, it's just almost definitely going to be something that you need to pick up on and react to. Like if a patient sort of says, oh, ever since my dog died or something, it might not be, but often that will be significant, and if you actually explore that in a bit more detail, it will open up a whole other part of the consultation. And if you just ignore a comment like that, you might kind of miss the crux of a station. So really actually be listening to the patient. The next thing I wanted to talk about was the 1 minute that's in between stations. It might be different depending on what medical school you're at, but for us it's a minute to come out the station you're in, read the next station while you're putting on PPE, and then go into the next station. It's a very sort of cliche thing to say, but you want to put the last station completely behind you in that 1 minute. Whether it went disastrously well or it went really, really well, just completely forget about it, because the next station is a completely clean slate. That examiner hasn't seen you. So even if you've just performed really well in a station, they don't know that. And to them, you're just starting from the bottom sort of again, and you've got to prove yourself again to that examiner. So don't be upset if one's just gone badly, because firstly, it might not have gone as badly as you think, and secondly, you can completely turn around your mark with a really good station next. Treat it like it's a brand new exam. Each station is a brand new exam. Take that 1 minute to just calm yourself down, read the station, and visualize what you're going to be doing. I found that it was quite useful to kind of think about how I would split my time to make sure I covered everything, and to kind of think, if I've not done the first part of the station in the first half of the time limit, then I need to be pushing on. So I kind of had that in my head. I'd be thinking about potential diagnoses. So for example, if the station says this patient's come in with a 6-month history of feeling really tired out all of the time, then you can use that to your advantage, and you can think, what possible causes of tiredness might this patient have? What kind of things do you want to explore? So you're almost adding a minute onto your station because you're getting that thinking time, which is going to help you. So use that 1 minute. Don't just stand there panicking. Calm yourself down and use it to your advantage so you can be prepared for the station. Lastly, when you're in the OSCE, if everything goes wrong and you completely blank out, you don't know what's going on, you don't know what the diagnosis is, you don't know what you're doing, you're just completely lost, then always take comfort in the structures that you've been taught throughout medical school. So from as simple as remembering the components of a history, remembering the differences in specific histories, so the differences in an obstetrics history and a paediatrics history and a psych history, thinking about your examination. So if you just completely forget what you're doing, just go back to the basics and think, have I inspected? Have I palpated? Have I percussed if necessary? Have I auscultated? If it's a joint, think, have I done look, feel, move, special tests? You just always have those structures to fall back on, and I think you can actually take a lot of confidence going into the exam knowing that you've always got that structure to come back to. Lastly, I just wanted to talk about after the exam, because I think although you obviously can't change anything, once the exam's done, you've done it, I think it's really easy for me to say just completely forget about the whole exam and just move on with the rest of your exams or whatever you've got next. But I know that this is actually so difficult, even more so than written papers. I feel like I often really ruminate on all the things that I think I've done wrong in an OSCE, and naturally, being human, you're going to magnify the errors and you're going to minimise the things you did right. So you're going to be thinking, oh no, I forgot to ask this question, I forgot to say this, didn't do the examination fully. But actually, you're not going to be thinking about all the things that you did really well. And it literally happened to me where I came out and I had a list in my head of all the things I thought I'd done wrong, and I literally thought I'd failed stations for things that were really, really tiny actually. And in one of the stations, it was like a psychiatry station, I thought, oh, I've missed so many things I wanted to say, things that I would normally say in practice. And I ended up getting full marks in the station. And I know that there's quite a few experiences of people having that happen where you think it's gone awfully and then actually you find out it's gone really well. So rather than me just say, forget about the exam, actually, you know what? If you want to sit and just take a couple of hours to just process the whole experience and think about the things you did in the stations, then I do think just do that. Because yeah, although you can't change anything, I almost feel like it's just such a big, like, the whole experience of the OSCE, it just happens so quickly and you just feel like you're kind of in a blur. It's almost like a bit of a surreal experience. You don't really know what's going on. You're kind of acting a bit robotically at times. You're just kind of regurgitating this information. You're having to be so intently kind of listening and, you know, really showing you're listening and being really like caring and empathetic. And you can kind of come out of it and think, wow, that just all went over your head. So if you do want to just sit and think about it, rather than just think about the things you got wrong, just make a list of all the things that you did do. Even if it's as simple as, you know, you took a history and you asked some good questions and you remembered each part of the examination. Even if you missed a few bits, you know, you remembered broadly your structures. Make a list of all the good things you did, because it really will make you feel better. And if there are things you've missed or you think you've done wrong, then just really try not to focus on them, because you don't know at this point how important those things are going to be. Even if you genuinely have got something wrong, it might not mean that you fail a station, it might not mean you get a bad mark. So it's not worth worrying about because you don't know the weight of it. Also, you might like to discuss with like your friends or other medical students how they did and what they said in the stations and things. And I think it kind of can be quite comforting if you all found one station difficult, or if you all said the same diagnosis, then you can think, oh, that's good, you got it right. But just remember that nobody knows what the absolutely ideal thing was to do in every station. So even if someone else did something that you didn't do, you don't know that that was actually really important and that's going to get them loads more marks. You just don't know what the mark scheme is. You don't know what the examiners are really looking for. So don't stress about it. If you like talking about it, then talk about it. But if you feel like it's going to make you worse, then just stay quiet. Don't get involved in the conversations about the exam. So I really hope this video was helpful. It's a video that I would have really liked to have seen before my own exam, and I actually take a lot of comfort in hearing other people talk about OSCEs, because it makes me feel like I'm not the only one that finds them scary and difficult. So I hope I've given you a bit of confidence if you're sitting an OSCE in the near future. The most important thing is just to remember that you have done the hard work already, and you just need to show the examiners what you can do and try to enjoy the experience if at all possible. If you like this video, please give it a thumbs up, and if you want to join me on my journey to becoming a doctor and you want to get more kind of medical school advice, then feel free to subscribe to my channel, and I'll see you very soon for my next video. Bye!